Scissors.
I think this is a fractured neck of femur.
Good spot, mate. Never easy to pick a garden one.
Jeez.
Walk. Doctor, King of England, makes no difference. All patients on my ward do what I tell them. Dextrose saline for Mr. Andrews, please.
You have antibodies to HIV, and the biopsy confirms Kaposi's sarcoma. You have AIDS.
I see.
I'll refer you to Dr. Singh at the General. He's the best HIV man in this neck of the woods.
Thank you, Dr. Yates. What's my CD4 count, please?
Not bad. 210. We'll see what Dr. Singh says, but we can repeat the count here in 1 month.
Okay.
No, you don't need me to tell you that HIV-positive doctors shouldn't be carrying out certain procedures. Far as I remember, the rule of thumb is that you shouldn't be doing anything with sharp instruments inside body cavities, so normal practice as an anaesthetist should be fine. You need to chat with occupational health about that.
Okay.
Right. 1 month. Be near enough Christmas, James.
Rough night, eh, Phil?
Well done, Jeff.
Thanks.
Dr. Kirkby here. Far away. Glucose 42.4. Thank you.
Guy in casualty took forever to try and get him an ultrasound. What's going on?
There are 5 admitted last night. The only one in Crippen ward is Alf Grokert, the bloke with CA lung, who was in last month.
Yeah, thanks.
This DKA...
Oxford Handbook of Clinical Medicine, Phil, page 738. Is Carolyn in today?
Yes.
Alf.
Doc. Like a bad penny, eh?
Andrew, should we make a start?
Dr. Turner, you know I've got to cover Dr. Yates' outpatients today.
I would have thought a post-take ward round took precedence over a clinic.
Well, since Claire was suspended, every Wednesday morning.
Oh, yes. You go and help Dr. Yates. I'm sure we'll manage.
Thank you.
Right, Phil, let's start upstairs, Dartos ward.
Well, obviously, most of your duties are in theatre, but occasionally you get asked to go to resus. Oh, this is Nick Stevens. He's the new SHO in anaesthetics.
Hello. Poor chap must not have seen it.
That's all your bits and pieces over there.
So are you attached to any particular team?
No, I'm giving clinical duties in Miss for a few weeks, concentrating on teaching and research. Okay? We have a fairly active programme of postgraduate education. There's meetings on a Thursday.
The meetings.
Thursday lunchtime. I'll show you the postgraduate centre.
And Mr. Grocott.
Oh, thank you, sister.
Back last night with a recurrence of his pleural effusion. Also, I thought I could feel a hard, knobbly liver edge.
Hello again, Mr. Grocott.
Right, Doctor.
Yes, sir, if you could just slide down the bed a little. Yes, thank you. That's fine. Arms by your side, please. Now, how is your breathing? Worse?
Bit.
Yes, I'm sorry you've had to call upon us again. I think you'll be with us a few days, while we get you right. Then we'll get you home.
Thank you, Doc.
Once you've fully drained the effusion, I suggest pleurodesis with tetracycline.
Yes, Dr. Turner. And that's the lot.
Excuse me, Dr. Turner.
Phil, I wanted to ask you, how have things gone?
Caroline?
Are all men complete bastards?
Why?
Step class was cancelled last night and I got in early and found Mick at it with some slag.
Oh, darling, I'm so sorry.
Two of us are doing the jobs of 3. The hospital claims that they're looking for locums, but I doubt they can be trying very hard. We're on call more often, we're stretched during the day. Andrew and I are dead beat.
Since Claire left, we've all had to... Well, you have my complete sympathy, Phil. Oh, I nearly forgot.
Wembley. The International next Wednesday night.
A present from one of my private patients. I'm chairing the regional gastro meeting that night, so...
Thank you very much, Dr. Turner.
Well, what I really meant, Phil, was how have things gone in general?
It's been a good job, thank you, Dr. Turner.
If a chap's face fits, he'll be looked after. That's what the old prof said to me when I was his houseman. I remember one of the registrars used to have to polish the old boy's Bentley every morning. Well, that's a thing of the past now, of course. But patronage, Phil, never will be.
Do you think that I could ask you for a reference, Dr. Turner?
I think I've already answered that question, Phil. Any thoughts on your future?
General medicine, the central teaching hospital rotation.
I doubt there'll be many superior candidates. I'm on the interview panel.
Portal hypertension is a fascinating condition. Fascinating. One manifestation is caput medusae. Slain by Perseus, if I'm not mistaken.
What does a case look like, Mr. Doherty?
A case? It looks like a box for putting things in.
Mr. Tomlinson, Mr. Doherty to see you.
We're putting your stent in tomorrow.
Taking it out.
We're taking your stent out tomorrow. Sister, that chap looks awfully familiar. You sure he's not one of my patients?
He's your registrar, Mr. Doherty.
Ah. Hors de combat. Well done, that man.
Mr. Doherty, everyone's talking about your retirement. I just want to say I'm sorry.
I'm not. Thank you, Scissors.
Hiya.
Hi. What's up with you?
Nothing.
Someone's been spicing your tea then.
No. I've been out of medicine for a few days and it's bliss. There's no more arguments, no more nurses nagging me. And when I get up in the middle of the night, it's to go to the loo.
You were pleased to hear there were no genital injuries? At least, none caused by the crash. Ernest, could I have a word, please?
Certainly, Adrian.
I thought I'd tip you the wink. The managers have decided to ask you to stay on.
Ah.
Our registrar's been stretchered off, and this out-of-court settlement will drain funds on the new consultant's post.
Adrian, do you know that a hospital consultant who retires at the age of 60 can expect, on average, to live another 13 years, whereas one who retires at the age of 65 has a life expectation of only 2 years? If that's all, Adrian, I'll continue my ward round. Ah.
I'm just about to do the pleurodesis.
It's okay, I'll do it.
Cheers. I'm like a blue-ass fly at the minute.
There's something I wanted to ask you. What's all this about my liver?
Almost certainly it's the cancer.
It's spread.
Yeah.
It's bad, isn't it?
Yeah.
Will I see Christmas?
I can't say.
How about the one after? Thanks, Andrew.
I'll get the stuff for you along.
Yates is my name. I work here.
Dr. Yates, I'm sorry, I was on Dartus ward with the septic lady.
Now, don't fret. You can't be in two places at once.
You still haven't told your daughter it's cancer, have you?
No, I haven't. She'll be here any minute. Don't reckon I'm in her good books lately. I told the padre to sling his hook. mean, I'm no saint, but I reckon I've done my bit. And then this happens. Makes a mockery of all that religious claptrap, doesn't it?
If it's easier, Alf, I can tell her.
No.
Right, there you go. Have an X-ray in the morning. You can go home if you're up to it.
Home tomorrow, eh, Dad?
Ah. Just a touch of the old trouble, eh, Doc?
I'll leave you to it. Carol. Let's go and get a coffee, yeah?
Okay.
The leak must have originated from this hospital. I've as much right to confidentiality as any other patient.
Whoever is responsible will be severely disciplined. We'll be taking advice as to whether we need to contact any of your patients for testing. In the meantime, I hope you'll agree that it would be best for all concerned if you were to take a leave of absence. Now, you'll notice that no specific reason has been given for the leave.
As soon as I became aware of my diagnosis, I contacted the Director of Public Health. I have agreed to relinquish clinical duties until we receive her guidelines. As long as I respect the bounds of safe practice, I'm not a danger to patients or staff. I will continue. Instead of conducting a witch hunt against me, concentrate on finding the git who leaked my diagnosis.
Yes? Double time for catering staff over Christmas is out of the question. Well, doctors and nurses can make do with what they find in the vending machines. Okay? Mr. Doherty, how lovely to see you. Coffee, tea?
No, thank you.
You may have inadvertently received the impression that your retirement would have been welcomed by this administration.
A young man has died, and we must provide financial support for his widow and his orphan daughter. Now, that is money you would have used to fund my successor. No, Mr. Tennant. I wish no part in your brave new world.
Prawn cocktail, your favourite.
Suppose you haven't read the papers this morning, then?
Of course I have. Who hasn't? Now have a crisp.
Aren't you going to ask me how I got it?
Presumably from unprotected sex with an infected woman or man.
How long have you known about my social life?
Medicine's such a conservative community. Coming out would ruin your career. Why should I have made it harder for you than it already was? Now you gonna have a ruddy crisp or what?
With the Christmas holidays, we won't get the result till next week.
Okay.
James, I'd just like to say what contempt I have for whoever leaked the story to the papers.
Merry Christmas, Dr. Yates.
Merry Christmas, James.
The boy needs a father.
The father's not been around.
He's around now.
Adrian, Stephen is not your son.
I don't believe you. It's too much of a coincidence. I demand proper access. He's 12 years old and still pulls underarm. He needs me.
No, Adrian. You need him. There is a difference.
Just a couple of IV rotors need doing, please, Phil. And there's chemo in the treatment room.
I'd never drawn up chemotherapy before.
It had gone 5 when it was ordered. The on-call pharmacist says she won't draw it up unless it's an emergency service. Try telling that to the patient.
Chemotherapy is drawn up by specially trained pharmacists wearing more protective clothing than an American footballer.
You can argue policy till you're blue in the face. In the end, it's the patient that suffers. I'll give it now.
Thanks, Andrew.
Ready? The patients are put to sleep, then brought to the operating table. I cut them open, fix what's wrong inside, and then zip, sew them up again.
How much did it bleed?
Oh, lots. When the blood gets this high, we all have to get into a special boat and do the operation in there. I bet you're really scared of blood.
I'm not.
I think if someone took some blood from you, you'd be a real softie.
Would not? Didn't hurt.
Press hard. Don't tell your mum, and I'll buy you that toy for Christmas. Go and get changed. And remember, this is Mr. De Vries. Could you run off a blood group for me, please?
All right, Trouble. What's the matter with your arm? Nothing. Right.
This was the letter of resignation I've had typed at the start of every year. Had the need ever arisen, I could have had it dispatched without delay.
That girlfriend of yours is a bit skinny, isn't she? You must enjoy the sound of bones cracking.
Mate, I've had a bit of a setback. My landlord's asked me to move out. I would take him to court. No one wants to live where they're not wanted. But with Christmas coming up,
The answer's yes.
God, didn't even have to threaten unprotected sex with Nazarene.
With Nazarene, unprotected sex means not wearing a crash helmet.
Why the hell's he still working here? And don't get me wrong, I feel sorry for the bloke. But with our kind of work, anything can happen. He could infect a patient or another member of staff. He should do the decent thing and resign.
Christmas in plaster. I should be out there getting plastered.
I've normally worked. My parents are divorced, so spending Christmas with one rather than the other just causes massive rows. Seems this place was the only family I had.
Dan's already got loads of presents. I wish I had leukemia.
Hello, kids. I'm one of the doctors from Casualty. I'm afraid I've got some bad news for you. We've had Father Christmas come into the hospital, and I've tried to save him, but now he's dead. So none of you will be getting any presents in the morning.
He's just come up from Casualty. He's got respiratory failure, he's got liver failure, he's got septicemia, his clotting's way off. Refer straight to pathology outpatients, I'd say. I've got to get straight to Casualty.
Dr. Colin? Alison? Is it? Happy Christmas. Because they're my friends.
Yeah.
I don't think it's asking too much for us to go out once in a blue moon. Yeah, well, I'm gonna go whether you like it or not.
I'm sorry, Vic. Dad's having none of this. How a loving God could do this to a good man. But perhaps you'll fare better.
Probably I won't.
Shan't be going home this time, son.
No.
There were times when I wanted to talk to him about it. It was cancer, wasn't it? At least he didn't suffer knowing what it was.
That at least.
There are phone calls to be made. Thanks for all you did, Doctor.
We can get him out of that bed. There's a patient waiting in casualty who needs it.
They'll turn into heartless so-and-sos sooner or later, don't they? Uh-huh. Happy Christmas, Andrew.
It's Phil. Will you accept a verbal message? Good. The message is, sod off.
Bloody ho. Ho, ho, ho. Merry Christmas. Ho, ho, ho.
Happy Christmas, Dr. Kirkby.
Happy Christmas, Dr. Collin.
Happy Christmas, all.
Happy X, what are you doing here?
Happy New Year.
Brilliant.
Oh, while I'm here, I just thought I'd take a look at that fellow with emphysema.
Right.
Tim and Janet will be waiting.
Right. Now, because we're not going to be local, Dr. Chan has very generously agreed to cover me.
We'll be fine.
Till tonight.
This is brilliant.
All right.
Festive
Enjoy your
Chinese.
dinner.
Happy Christmas.
Pam's making a formal complaint about you swearing at her last night. And Mr. McIntyre needs his chemo drawing up.
I know.
Yeah, I couldn't work it out either. Well, maybe you could ask Andrew.
I have.
Okay. Look, I realise that the pharmacists have been asked not to come out unless it's an emergency. This fellow needs his chemotherapy. And I'm telling you that it's not my problem. Fine. Hello, could I speak to Dr. Turner, please, at his home? Dr. Turner, Phil here. Yes, I'm sorry to bother you tonight of all days. It's about Mr. McIntyre's chemotherapy. I can't find anyone who knows how to reconstitute it. Yes, Dr. Turner.
Morning, Jeff.
Hello, Doctor.
What did Santa bring you for Christmas then?
Nothing.
Emma, you fibber. Tell the doctor what you got.
A Game Gear and some other toys.
Oh, fantastic. Well done, Jeff.
Thanks,
Happy
sir.
Christmas.
Thanks. Same to you, Doctor.
He's got massive laryngeal edema. Hydrocortisone and Piriton are given. Let's get that adrenaline going, please, Debbie.
Okay.
Has he ever had a reaction to his chemo before?
No.
Must have been mixed up wrongly.
We're in.
Well done. Output's fading. Let's get that adrenaline going, Debbie, please. Phil, start CPR. Debbie, adrenaline a milligram, atropine 3 milligrams. Phil, start CPR now! Atropine. Let's get an adrenaline ready for after the next 10 cycles.
Andrew, we've been going for over an hour now.
If you want to go, go. Phil, get a milligram of adrenaline ready.
I think we should stop now, Andrew.
Thank you, everybody. Leave everything where it is, please. It's just going to have to go to an inquest. I'm sorry, Phil.